My name is Christina Hildebrand. I am the founder and president of A Voice for Choice Advocacy. For those of you who are not familiar with us, we educate, advocate, and empower people to know their health rights in California. And that usually covers three different areas. That is being informed and knowing the ingredients of products that go into your body, having informed choice and transparency. It is getting rid of toxic substance out of our environment and our bodies. And then also we do some work on the medical privacy side of things where there are loopholes, and we want to tighten those privacy areas up. So I'm going to get started today and just sort of give you an update. And this, I realized I wrote this in September and it should say October update, but we are going to do an update end of September, beginning of October. And I specifically wanted to talk this evening about AB 144 and what that means. If you haven't heard of it, it was a bill that was gutted and amended. What that means is all the information was taken out of the bill and it was replaced with other information in the last few days of our legislative session. So the California legislative session runs from January until September. By September 12th, all bills had to be on the governor's desk if they were going to get reviewed by him. And this bill 2 days before the end of the session, so on 3 days, September 9th, was gutted, amended, and 66 pages worth of bill language and changes to the statute were added to it. This is highly unusual, but it happens in California. And the reason for it, so usually it goes, a piece of legislature, usually a bill goes through the full legislative process. So it's introduced in January, it goes through committee hearings in one house, it then, if it gets voted through, goes to the floor, goes to the other house, goes through committee hearings in that house, goes to the floor, and then finally makes it to the governor's desk. This one did not go through any of that. And I would say, the bill is harsh and it does a lot of things that we don't like. But at the same time, I think that for me, the worst thing about this bill was that it had absolutely no public input, no stakeholder engagement, and no committee hearings. And so what happens to a bill in California usually is that it goes through that process and it gets refined in those committee hearings. It gives a chance for the author of the bill to have conversations with those people who are opposed to it, who wanted to make it better. This bill had none of that. And I think, to me, that is really the sign of, it's a lack of transparency. It's a sign that they were just trying to ram this through at the very last minute and they don't want public input on this one. So what did AB 144 do? It did a lot of things. As I said, it was 66 pages long, and it was a budget trailer bill, which is why it was allowed to go through this process so quickly and not have committee hearings. The budget trailer bills have slightly different rules around them, but there were many rules that were waived, which is completely legal. We've gone through and to see if there was anything illegally done on this, and there wasn't, in order for them to push this through. A budget trailer bill is usually supposed to have just items that refer to the budget. So what happens fiscally and what is needed to be put in there so that California can keep running. This bill had a number of things. Some of them were budget and many of them were not budget related. There were some things in there that were necessary and were fine. Things like the fact that doctors in the Olympics, doctors who did not hold a California medical license could practice medicine in California. We've got the Olympics coming and we've got that coming, and that was necessary. But the other thing that they did with this bill was they basically did a find, replace in the whole of the California statute, searching for the CDC and ACIP, so the Center for Disease Control and the American Immunization Committee. Those two, they took those and they crossed them out throughout every piece of the statute, and they replaced them with the California Department of Public Health, except in one place, and I'll get to that place. But they replaced it with the Department of Public Health in California, meaning that the state would make changes to anything that used to have the CDC and ACIP making those determinations or relying on those. The other thing that it did was it planted in place everything, vaccine policy, anything that referred to the CDC or ACIP, it said we're going to hold that in place, put a placeholder from January 1st, 2025, that the vaccine policy that was recommended at that time and any other policies that were recommended at that time, that gets stuck in place from January 1st, 2025, and any further changes to that have to be made by the Department of Public Health rather than the CDC. So, where does that put us? Well, they're very vocally, and Governor Newsom said this, saying that we don't trust the Trump administration, we don't trust Bobby Kennedy, we don't trust the CDC, we don't trust the American Committee on Immunization Practices. And we, California, are going to take charge of that. We're going to make the changes in vaccine policy. We're going to guide that, and we're going to do that. Now, they had, a few weeks earlier, Governor Newsom and the governors of Washington, Oregon, and Hawaii had announced that they were putting together a West Coast Health Alliance that would be reviewing all vaccines and vaccine policy and the science behind it and making recommendations. And so this wasn't really a complete surprise because we knew that. There is also, so we have our West Coast Alliance, there is a Northeast Alliance that includes Massachusetts, New York, Connecticut, all of those Northeast states, and they're basically doing the same thing. So when they went through this statute and they basically replaced everything that said CDC and ACIP and put in the California Department of Public Health, that really centralized power to California and making those recommendations. And there have already been, just by passing this law, that changes a few things with the vaccine policy. And when I say policy, that's the recommendations that your doctor is going to give to you based on the policy, which used to be always ACIP recommendations, and now is the California state recommendations here in California. And two things that are different. One of them is the COVID vaccine. So when the CDC last met and HHS Secretary Bobby Kennedy, when they put out that the COVID vaccine was now no longer recommended for babies 6 months to 65 years, and then to adults 65 years old if you're healthy. Above 65, it's recommended, and for anybody who has comorbidities or other immune issues, that they can get it. But it is a shared decision making. So that means that it's between you and your doctor to have that conversation and determine whether the COVID vaccine makes sense for you. California put us back to January 1st, 2025, and also issued a winter respiratory guideline for vaccination, which included recommendations for COVID, flu, and RSV. The flu and the RSV are in line with the CDC current recommendations, but the COVID shot is not. The COVID shot says that everyone 6 months and older should get that COVID vaccine booster. And I'll get into what the liabilities are, what the ramifications are for having those changes. The other place that changed was the ACIP, just this last meeting, which was earlier in September. They decided that they voted on that the MMRV, so measles, mumps, rubella, varicella, there is a combination four virus shot, that shot should not be given to children under 4 years old, and that it's recommended for above 4 years old. Under 4 years old, they should get the MMR and then a separate varicella vaccine. And the reason for that is there were a higher number of seizures for children. If you got the combined shot, there were a higher number of seizures. So they just changed that recommendation. California has come out and said, nope, you can do the MMRV under 4 years old as well, and that some parents want to do that, and they should do it because they want to do it because it's 1 shot versus 2 shots, and they want to use that instead. So where does that put it? So it really, as I said, it centralizes power. It also confuses doctors and patients. So what are doctors in California now supposed to do? Are they supposed to follow the California guidelines only? Are they supposed to follow the federal guidelines? Are they supposed to make up themselves, decide for themselves which ones they want to follow? And we have seen so many doctors be penalized and have their medical license revoked or penalized um, or put on probation because they didn't follow the schedule previously. So at that point, it was doctors that wanted to space vaccines out, or they were giving recommendations that went against or didn't follow the ACIP federal recommendations. And we have doctors that did that and were penalized for it. And so the question now is, will a doctor be penalized for not following the California recommendations, for not following the federal recommendations, for, giving their own opinion on vaccines, which we know has been a no-no in the past? And I think it also confuses parents. If you are going to go vaccinate, and the federal guidelines are one thing and the California state guidelines are another thing, where does that leave you other than very confused? So that's a real issue here that, COVID already lost the trust of public health and of the pharmaceutical industry and all that, and this is just pushing it more in that direction, which may not be a bad thing, but if what California wants to do is to gain the trust of people, in my opinion, this isn't the way to do it. Um, it also erodes parental rights and medical judgment. So as I mentioned before, the one place where the CDC and ACIP were not replaced by the State Department of Health, and this is the one place that it applies to SB 277, which was the bill that removed the personal belief exemption in California and left us only with a medical exemption, is that in the medical exemption wording in our statute, it specifically says that when an expert, so the way that works is you submit your information into the CareME system, your doctor does, and then it asking for a medical exemption. And then the California Department of Health can review that and usually does review that. And in reviewing it, it used to be that they had to take into consideration the CDC guidelines, the ACIP guidelines, and the AAP, so the American Academy of Pediatrics guidelines. And they could use any of those to determine whether the medical exemption was valid or not. This bill removed CDC and ACIP and leaves the American Academy of Pediatrics. And that is really, really troubling because, and I will also say that, the Department of Public Health is also going to be relying on these industry organizations, so on the AAP, on the AMA, American Medical Association, and on other associations that are not scientific, research hubs like the CDC is, and they are also backed by the pharmaceutical industry. So if you look at the money going into the American Academy of Pediatrics, Pfizer, Merck, all the other vaccine companies are heavy, heavy donators to that organization. So it's really a biased organization. So I will say that, it is extremely hard to get a medical exemption in California. So I don't think this change is really going to change anything when it actually comes to the logistics of putting in a medical exemption. But it does change that, and it really is now putting a very biased view onto that. The one thing that I will say that it does not do, so there have been other organizations, and I got an email today again or text saying, is there an HPV vaccine mandate for college or for school? And back in 2023, a Voice for Choice Advocacy and other organizations fought really, really hard to stop a bill that was going through the legislature that would have required high school students to get mandated. They then changed it to college students were mandated. It then got rid of the mandate, but set it as an expectation. And then we got that even reduced to an advisory. And so, yes, seventh grade and college students get an advisory letter saying you should, the ACIP, CDC, now the Department of Public Health recommends you get the HPV vaccine, and it has an advisory statement on it. And that statement now used to be linked to what the CDC recommendations were. That statement now is linked to the Department of Public Health. So for that statement to change, that advisory statement to change, the Department of Public Health is the one that's going to have to make that change to that advisory. But that is all that happened. It is just an advisory. There are no mandates. There are no requirements for the HPV vaccine for any level of education here in California. I went through this already, what the differences are. What I've been asked and what we've been doing quite a bit of research on at a Voice for Choice advocacy is this legal? And not is it legal the way the bill was put through. We determined that that is legal. The bill was put through in a rush. It shouldn't have been, but it was. Um, but are states allowed to have state vaccine policies? Is that something that is allowed? Is that where it should sit? And what's interesting is I hadn't really thought about this at all until this bill, because my understanding or my thought process was, yep, the school vaccine laws, we have been told, over and over again, it is settled that school vaccine requirements sit at a state level. But the the vaccine policy recommendations, just the recommendations overall of what children should have always sat at the I shouldn't say always, but have sat at the federal level since 1986 when there was the National Vaccine Childhood Injury Act that was put in place and that put the National Vaccine Compensation Program in place, that put ACIP in place, that put all these mechanisms in place. And so that sort of elevated it to the federal level. The other thing that happens at the federal level is the vaccine childhood program, which basically is a low-income program, for the federal government, gives states and gives pediatricians vaccines that are less expensive and allows them to give them to low income on Medicaid, Medi-Cal, Medicare, depending on what state you're in, but allows them to get basically vaccines for low income people. Those sit still at the federal level. So one of the areas, but vaccine policy could very well, and I was reading an article by Robert Malone, and he sits on the Committee for Immunization Practices now, and he mentioned that vaccine policy should sit at the state level and could sit at the state level, which is an interesting change because that hasn't been the place that it sat. Obviously, the Western states, the Northeastern states have sort of taken it upon themselves to say that, but you also see Florida on the other end of the spectrum also going in, and they came out during COVID and went against the federal government's recommendations on the COVID vaccine. And so you have this change there as well on the other end. So I think we will be seeing many, many more states creating their own vaccine policies and their own vaccine guidelines. I think one thing that is, I'm going to say very frustrating, this is sort of a side note, but frustrating for me is that every single year when we were talking to legislators about vaccine mandates, about vaccine policy, about school policy specifically, about the fact that, the hepatitis B vaccine shouldn't be given at birth, that various different conversations we've had over the years with legislators and their staffers, they always said to us, well, if the CDC is basically God on this. If the CDC recommends a vaccine, then we're going to go with that. California is not going to go against the CDC and the recommended schedule there. And so that was the sort of, okay, we're going to shut them up with that argument. Well, now that the CDC and ACIP are giving different recommendations that they don't like, that we personally like, but they don't like, suddenly it's, oh, forget the CDC. We don't trust them anymore. We're going with our own recommendations. And so it's a little frustrating. I'm actually this sounds crazy, but I'm actually looking forward to having conversations with legislators about this bill and about the differences and how these conflicts and these liability gaps and the possibility of jeopardizing federal funding, how this bill has impacted that and what we would like them to do about it. And I think it definitely, this bill has given us the opening to have more conversations on this issue and on these issues than we have before. So, I always look for the silver lining in things, and that's my silver lining. But so, it does, as I mentioned, it creates liability gaps. So, for example, There is a clause in the California statute, was already in the California statute that said that mirrored the federal statute that you cannot sue a doctor for any injury that's done by a vaccine if for the doctor who gave that or the nurse that gave that vaccine. And that was already in our statute. It did say any vaccine that's recommended by the American Committee of Immunization Practices, by the CDC. And so what's changed now is that they expanded that liability to doctors and said any vaccine that's recommended by the California Department of Public Health. Well, what's interesting there is that the National Vaccine Injury Compensation Program and the 1986 Act specifically has to do with the vaccines recommended by ACIP. And so this is an open question, but what happens if a doctor in California gives the MMRV vaccine, for example, to a 2-year-old? So that is not recommended by the federal government, but it is recommended by the California government. Does that parent, and if that child gets injured, for example, yes, they're covered by California law that there's no liability, but could they go to the vaccine compensation program and get financial assistance there? Probably not, because that national compensation program is tied to the federal vaccine policy and recommendations. And if it's not recommended on there, then the question is, could somebody go and get compensated there for a vaccine that was not on that schedule? So it's going to be interesting on that front. The other place where, as I mentioned, there are these low income vaccines that are given by the federal government, and will the Trump administration, for example, stop that funding because California doesn't have the same schedule? Or if a practitioner we've heard over the years that a practitioner, for example, there was a practitioner that would not give the COVID vaccine to children, and they would not order the COVID vaccine. They had about 9,000 patients that were on Medi-Cal, and they would not offer the COVID vaccine to those patients. And their whole practice, they lost all the funding for their low-income vaccines, and their practice basically was shut down. And so the question becomes, the flip side of that is, if a practitioner is giving the MMRV vaccine to under 4-year-olds, and that doesn't follow federal guidelines, well, could the same thing happen? And so those are questions that, we're just going to have to see what happens. But it's going to be interesting times here in California, seeing what does actually happen. So as I mentioned, this gives us an opening to the door of what we are going to be focusing on. So the governor has until October 12th to sign or veto bills. If he doesn't veto a bill, and he doesn't sign it, it becomes law. So by de facto, if he doesn't sign it, it becomes law. He does usually sign all bills or veto all bills. Historically, there are I'm going to say, I think about 900 bills on his desk. I don't think he's signed very many of them as of yet. I know that he's done chunks. This one, AB 144, he did sign within 3 or 4 days, and I can guarantee you that was because of the push we had to ask him to stop it. It shows that we are extremely effective in this case, not in the right direction. But we flooded not we, but you all flooded his office with emails and nonstop phone calls. We had at least 5,000 to 10,000 emails that were sent to him through our platform alone. And so, when their emails and phones are being clogged, they usually take action pretty quickly. But we will see what happens. But as I said, the bills are on his desk. And between I'm going to say mid-October to December is when we go and talk to legislators and their staff, and we have usually around 10 to 15 bills that we are quote unquote shopping, that we want to get a author to pick up and to sponsor and to author, and then we become the sponsor. And so we've been successful with that in past years. And even if not, it's very, very hard to get a bill authored by a smaller organization like us. If you take, the California Medical Association or any of those types of organizations, the Teachers Association, they can wield their power and their money. But we don't have much money. We have more power as the years go on, because people know us for who we are. and we have a good relationships that we've built over the years. But we also have bills on there that we not necessarily don't think could get authored. We think all of them should be authored and could get authored, but we often have bills on that list that we have there just as conversation starters to have the conversation. For example, fluoride. We have had that on our bill list for the past, I would say, 9 years, and it is that we have the conversation and we keep going. And that one may be one that we can get authored this year. Hopefully we can, but it is one that we have on there specifically to have the conversations with legislatures so that they are informed and educated about different topics. So what is our focus this year on this issue specifically? We are focused on two things, which is well, three things, but two of them are really from a legislative perspective. One of them is shared, and they go together, shared decision making, and the other one is informed consent. So what is that? So shared decision making is really in the doctor's office, that you are having a collaborative process with between the doctor and the patient, and that it really benefits that you're having that conversation, that parents can bring up or patients can bring up their questions, their concerns, and really have that conversation with a doctor and are making decisions for their health as a shared process, and not just the doctor saying, well, this is what I think should happen, this is what you should do, go do it, and sort of pressurizes you. And I have had these conversations with doctors and dentists, and I even feel pressured. And out of all the people in this world, I shouldn't walk out of a doctor or a dentist office feeling like, oh my God, I just felt pressured into saying yes on something, or really having to push the system to say no. I feel like I'm educated enough in how to do that. And I very often, not that I go to the doctor's office very often, but I have definitely been in situations with both my children and myself where I just feel like I am being pressured and I haven't been able to ask the questions I've wanted. I haven't been given the time to research, to do my own, feel good in myself about the decision I'm making. And so that leads to the second part of this, which is informed consent. So really what informed consent is again, talking to the doctor, talking to your healthcare provider about the benefits, the risks, and the alternative treatments for a medical treatment, and especially medical treatments. So from a bill perspective or a statute perspective, especially treatments that can result in death or severe injury. So we feel that that should be happening all the time. It's unfortunate it isn't. Usually the challenges are time constraints, insurance billing, is really the pressure of that doctor comes in and they've got at most 4 or 5 minutes with you. They need to get it done, and they need to really push you out the door, or at least push themselves out the door. And then the last thing is removing vaccine mandates and having religious exemptions. We've seen Florida remove vaccine mandates completely for schools, which is amazing. If there's one thing people ask me, it's like, what would you like to see happen in the future? It's that, no person should be required to take any medical treatment for the sake of going to school, for the sake of employment, for any reason. And so, my question is if vaccines are, or my statement is if vaccines are so good, and this was published in the LA Times recently. But if vaccines are so good, then why would you need to mandate them? And that we're doing really with our SB 277 lawsuits. We have two of them. One of them is to get a religious exemption in place. And then the other thing is we have a religious exemption workshop and are doing advocacy. And I'm going to send out an email in the next week of just all the different areas. I mean, there's probably 10 different areas where we are advocating for religious rights, especially when it comes to vaccines. So that is the end of my presentation on AB 144 and what we're doing. And then I'm going to switch to a Q&A. So I do see a bunch of questions and no answers yet because I haven't given them, but I do see a bunch of questions in the Q&A. So going to the questions. First question, does Kennedy have any power over Newsom in California? So not really. I'm going to be completely honest. The one place where they could is, as I said, pulling that federal funding for vaccines that are on that low income vaccine program. So that's the only place that they could use leverage. I don't know if they'll sue on. I think, as I said, we've got our lawyers looking into whether AB 144, whether having the vaccine policy at the state level is legal. From everything that I've read, yes, it is. But if it diverges too far, like the liability, those types of things, then I think there may be some ramifications. But I think unfortunately somebody is going to have to uh, be harmed first before you can bring a lawsuit because you have to show harm to have a lawsuit. Okay, next question. How are things looking regarding reestablishing an exemption in California? What do you think in terms of timeline with your lawsuit, and how hopeful are you feeling? Thanks for all you do. Yes, so timing is everything, right? So our lawsuit, we filed it last 2 years ago. 2023 is when we filed it, and it has moved through the court. This is the religious exemption lawsuit. We have two lawsuits. But the religious exemption lawsuit, it moved through the lower courts. We amended it twice. That means we filed three briefs, went through three processes. We also, thankfully, I'm going to say, got a chance to put forward a brief on the Royce decision. So there was another lawsuit that is a similar lawsuit to ours, and it went ahead of ours. And our judge allowed us to comment on that judge's dismissal order. And so we got to put in extra information, which is really, really critical because when you go to the appeals process, you can only use the information that you have put into the briefs in the lower courts in your appeals process. So you cannot bring in new information. And so that actually allowed us to put in a lot more information responding specifically to the issues that were brought up in that judge's order that was dismissed it. Now, our judge also dismissed it, but it allowed us to have that information and those counter arguments in there. So we have gone forward. We have filed a notice of appeal. We are filing the brief this Friday, the 8th, and we will get a response probably by, I think it's the 15th we have to have a response by, and then we get to file a response to that response, and then it goes through to the appeals process. Now, the appeals process can take 6 months, 12 months. It can take a really long time. So it is, and if we fail the appeal, if we win the appeal, it goes back down to the lower courts and tells that judge, sorry, you were wrong. You need to adjudicate this. If we lose the appeal, then it goes to the Supreme Court, and we are planning on fighting it there as well. So we'll see. I think, I think it will be another 2 years, I'm going to say, possibly 3 years. It may come sooner, but it may come sooner not because of the legislative process. So I see things happening on the federal level with the Religious Liberty Commission, with things that Trump has said, with things that the HHS Secretary Bobby Kennedy has said. I think there is a chance that the federal government will put some pressure on the states or say that, you can't get funding, for example, for public schooling if you don't have a religious exemption. Now, I don't think California is going to crumble for that. I think Newsom will fight that and will, put lawsuits against it saying, nope, we're going to win this. We're going to fight this. So I don't think it's as much as now in the interim, are they going to risk federal funding not coming to the schools? No. And as I said, I don't know that they're going to do this, but if they were to do this, I don't think they are. So I think we'd get a religious exemption in the interim, and I think that would help our lawsuit. It doesn't hinder our lawsuit. So I think there are some things that, I think in the next 12 months, we will see some things that that will help us in that realm. And we're working on all of those. So there is a Religious Liberty Commission meeting in February, which we are hoping to have our lawyers be a panelist on, and that's specific to vaccines in schools, and religious exemptions. So there are things happening. I just think it's, I think we don't know all of the pieces of the puzzle or the next five moves on the chessboard that the federal government at this point does know. Okay. Next question. Can inpatient hospitalization vaccinate us without our consent? They cannot vaccinate you without your consent, but you may have given consent inadvertently. I would highly recommend going to our blog, which is on our website, and or our Substack. So our Substack is avoiceforchoice.substack.com. It may be substack.avoiceforchoice.com. But if you go there, we had an article. So we write an article every single week. We have amazing writers, an amazing editorial team that puts out a article every single Thursday, every week on Substack, and we push it out to our newsletter every other week. We put sort of a summary of what went out. But I would highly recommend reading those. And we did have an article specifically on this topic of what are the papers basically you're handed when you enter a hospital and what you need to look out for them. So one of the things in all of that hospital documentation that you're usually signing off is it may have a reference to biologics. It may have a reference to that when you, especially when you're under anesthesia, that you consent to allowing them to take any necessary measures that they feel are necessary in order to move your case forward. Or, those aren't the exact words, but they're basically what it implies. And what that implies is, if they feel like, well, we need to give her a vaccine because that's our prerogative and what we think should move the case forward, let's do that. It will be in your medical records if they do that, but they can't force you to have a vaccine in order to enter a hospital or any of those types of things. But can you inadvertently authorize it? Yes, you can. So my answer is go to our Substack or our blog and read that article in detail because it's a really great article. Okay, is California still requiring COVID shots for healthcare workers? They are not. As far as I have seen, they are not. The majority, it's an interesting one because the majority, so let's go back to pre-COVID. Pre-COVID, every county required, or the majority of counties required healthcare workers to get the flu vaccine. OSHA, which is our Occupational Safety and Hazard Standards Board Authority, they have a regulation in there that for the flu vaccine, you have to, the employer, the healthcare employer has to offer you the flu vaccine, but you also have to be able to decline it. No questions asked, no religious exemption, no questions asked. When COVID came along, pre-COVID, most healthcare facilities stated that if you didn't do that, you had to wear a mask. You didn't have to wear a mask if you were vaccinated. Makes no sense at all. I get it, especially with the flu vaccine efficacy rates. So COVID came along, they required the COVID shot or a declination. Well, some of them just required a COVID shot. No way to get out of it. Some of them allowed you, they had to allow you a religious exemption, but some of them put you on unpaid leave if you didn't get a COVID shot. So inevitably, it was like you had to have a COVID shot. And they required masking. And those were healthcare, usually on the county level, healthcare orders. Since COVID, it's clear they've realized that neither the COVID shot nor the flu shot have efficacy, and or that they're going to lose too many nurses and healthcare, nurses, doctors, all the rest of it, healthcare professionals, if they require the COVID and flu vaccine. I'm not sure why, but they're not requiring either of those now. Most places are not requiring either of them. But what they do have is most counties, not all counties, definitely the counties around where I live, so Santa Clara, San Mateo, San Francisco, they were the worst during COVID too. So I would go with, if your county was bad during COVID, then you most likely have this order. And that is that you're required to wear a mask, regardless of whether you're vaccinated or not. You're required to wear a mask from, I think it's October 1st to March, April. So it really depends, but there is no requirement. OSHA still has in place. So if your place of work requires you to get the vaccine, the COVID or the flu vaccine, OSHA still does have in place that declination form that they have to allow you to decline the vaccine, and you should just be able to decline it. Okay, next question. It looks from the legislation that your children have to be vaccinated to receive CalWORKs. Looking at CalWORK's website, it looks like there's a personal belief exemption. It says it applies to 6 years and under. Do you need to have your child vaccinated in order to receive CalWORK's benefits? So this is a great question. This is something that every single year there is a CalWORK's bill that comes up where they're changing something in CalWorks. It doesn't have to do with the vaccination. A couple of times it has had to do with the vaccination. And we have watched it or we have fought it because, yes, there is a personal belief exemption still in CalWorks. And so you have to just fill out the form. I think you have to sign it. You have to make a statement that it's against your personal beliefs. I don't remember if you just X a box or if there is something that you actually have to state. But you do not, vaccines are not required for your, if they if you're getting CalWorks for them. So no. Please do, if you have anyone you know on CalWorks, please do spread that far and wide because they don't make it obvious. They're supposed to, but they don't make it obvious. Okay, next question. The bill says the HPV vaccine is recommended. Does that mean it's mandated? If so, that for all students 8th grade through college, or if your child, say, is a junior in high school, can they stay in high school and graduate without it? So I addressed this in my presentation, but no, the HPV vaccine is not required. There is an advisory that goes out that reverberates what the CDC and now what California Department of Public Health says, which is that the HPV vaccine is a recommended vaccine, as the other 72 doses, 72 vaccines that are on the ACIP schedule and on the California policy schedule. So it is the same as that. That's the recommendation. Recommendation does not mean required, and it doesn't even mean, that we really pushed for the recommendation wording versus they had it prior in that bill when it was going through the legislature. They had it that it was expected, and our argument there is, well, if I tell my kids you're expected to do something, or if I tell you you're expected to do something, it's pretty strong wording, and you're like, oh, crap, I'm probably going to be in trouble if I don't do it. And so we really pushed for that recommended wording because it does, and people knew like during COVID that, it was recommended that you wear a mask in a place, but it means you don't have to and there aren't any consequences. Do you have any advice for nursing students when we are being told that we're required to have the COVID vaccines as part of acceptance into nursing program, despite the new federal recommendations? So this is a great question, and this is a place that we have really helped a lot of students. And we helped during COVID for those students that were struggling with religious exemptions for college, for employment, for whatever else, wherever else they were being required. We on the final group that the COVID vaccine has not been removed from, and it's been removed from colleges because Trump has an executive order that says no college will get federal funding if they have a COVID vaccine requirement. So the schools themselves can't mandate the requirement. But what happens is the clinicals where you go, so the hospital rotations, the other healthcare setting rotations, hospice, those types of things, those settings are requiring the COVID vaccine. Now, they say there is nothing other than a medical exemption, that there's no religious exemption, there's no personal belief exemption. There usually isn't a personal belief exemption, it's a religious exemption because the religious exemption is required by the Civil Rights Act. And so all healthcare staff in those hospitals and other places, they're required to offer a religious exemption. And they do offer them a religious exemption. But they don't make that so the Civil Rights Act doesn't really cover it. It covers employment. It doesn't really cover students. And so this is this gray area, this loophole that they have found. We have helped a number of students that have been required to get the COVID vaccine, or that's what they state, or a medical exemption, to be able to fulfill their requirements with a religious exemption. And so if you are having that issue, please, please, please come to us. And we can help you. We just had a win in Minnesota. She was doing a PhD in speech pathology, and they would not allow her they took her out of the program even because she couldn't get the clinicals worked out. And what we found is that if you go directly to the clinical sites and have the conversation with them, and please come to us to get you the right language and to help you maneuver through that process. But if you use the right language, and you go to those clinical sites directly rather than try and maneuver it through the schools, that you can be successful in getting those. And she finally, it took them 2 weeks, the clinical places, it took them 2 weeks to respond, but they finally allowed her to go with a religious exemption. And in doing so, they reinstated her place in the PhD program. So it was a great success, but we've had a number of those, helped a number of students there. So definitely reach out. It definitely is doable. Okay, next question. Okay, next question. Is the pharmaceutical liability protection affected by this at all? If California is recommending something the CDC is not, example, the COVID-19 vaccine, are pharmaceutical companies still shielded from liability? So this is an interesting question, and this is one of the things we're looking into specifically because it is that. So you're right, they are shielded from the perspective of if it is on the childhood program, then they are shielded. And my understanding is that they are shielded regardless of what age group is given that vaccine. So, for example, the HPV vaccine is on that recommendation. And even though it's a vaccine childhood program, if you are not a child and you get the HPV vaccine, you can go and you can not sue them, but you can go to the vaccine compensation program. But the question is if the MMRV, for example, or the COVID vaccine that is not recommended for a child, not on the ACIP schedule, can you now sue the pharmaceutical industry? And I think the answer may be yes. It is a place that we're having our lawyers look into. Again, there would have to be harm done. So somebody would have had to have gotten that vaccine. But we know many people vaccinate, harm is done, the child's injured, and that's when they wake up. So it's unfortunate that that's the case. But I do think there is a possibility, yes, of suing the vaccine manufacturers. And so we will see, we will see what comes of that. Although it's not mandatory to get the HPV vaccine, how easy would it be for them to make it mandatory? So as I said, we fought that in 2023. They were trying to make it mandatory for school. We fought it. They lost. It is that legislature's, so Assemblymember Aguilar Curry's last year in the legislature this year, I think, or she may have till 2028. I wouldn't be surprised if she tries to bring it back, but I'm not sure she really wants to. I think she got enough flack for it that she may not want to. It would have to go through the legislative process. The only other way is that the Department of Public Health puts it in place, but per our statute, if that happens, there has to be a personal belief exemption for that vaccine. So you would be able to choose to opt out of it. So one of those two things could happen. Both of them, I think, would get a lot of pushback. And I think the fact that we were able to defeat that bill in 2023 and just make it an advisory, shows that it would be a struggle. Are there any opportunities for health freedom here in California? I think there are a lot of opportunities for health freedom. I wouldn't be here still, and I wouldn't be fighting this if I didn't think there were opportunities. I think there are definitely opportunities. I think what's happening is there's a lot of I wouldn't say a lot, but there is some the people who are fighting for health freedom are doing it outside of the box. So there are healthcare practitioners that are looking at wellness, not at sickness. And so are putting, they have practices where you pay a monthly fee and everything's included in that monthly fee. And you can go to them as many times as you want. But their hope, that mentality means they want to keep you as healthy as possible because the more you come in, the more money they're losing on you, which is, in my perspective, the way that we should be looking at healthcare, that it is truly healthcare and not sick care. I think the other place that we are having enormous wins and that California really has taken the lead on is the MAHA movement, the Make America Healthy Again movement, from the perspective of food, and specifically toxic substances in our food. So California was the first state to ban red dye, number three, which the federal government has now done. We've had bills in the past few years that have removed all dyes from school food. We have a bill sitting on the governor's desk that we did a lot of work on that would remove all ultra-processed foods from children's school lunches here in California. And we had a bill last year that removed all bisphenol. So BPA, bisphenol A, was removed from children's products, but we had one that was removed last year for all bisphenols, and that was a bill we sponsored last year. We've got a lot on the environmental front, and this is a place, I will say, whatever you think of Trump, that they are removing regulations from the EPA and the environmental toxicity, which California has in place. So, there are places where the levels of lead, PFAS, other things in your water are very heavily regulated here in California, and it's for good reason, for healthy reasons. And so I do think when we look at California, it's actually a really cool place to sit at the moment, because we are at the forefront, and it's the Democrats that are leading that charge. The Democrats have always led the charge on the environment, and so kind of puts it in the place of where RFK Jr. started this whole thing. It was with river keepers on the Hudson River and cleaning up the Hudson River, and making those changes to our environment that are really Democrat policies, have been in the past for a long, long time. And so it's good to see bipartisanship coming of that, and having a president that also values some of those things. I wouldn't say that they're all there, but he's definitely for big oil and big gas, though. Which most environmental people here in California are not. Okay, next question. This question, or this comment, is: informed consent needs to be coupled with informed refusal. It needs to be understood that people can deny treatment and services, and consent should not be expected just because information has been given. Absolutely. And I think you make a really good point, and I like your wording there, and I will use it in our legislative conversations. But I think, from our perspective, the informed consent, it is that you're consenting. So it's not even that you're refusing. It's the fact that you have to give consent to any procedure, and that consent is not expected. It is the thing that you do once you are informed. But I like that comment, and we'll use it. Okay, is the process that CDPH must follow to recommend a vaccine to be on the schedule, or is it just their whim to add vaccines? It's basically their whim. So it's not so just to be clear, it is the recommended schedule for children and adults. So these are recommendations. Again, there are recommendations at the federal level, but having said that, if you go into a mainstream doctor's office, they're pushing all these vaccines in part because they get paid for them, and they, can keep you on that child schedule of, 1 month, 2 months, 4 months, 6 months, 12 months, and you've got, or even 8 months, and they've got your kid coming in, and they're making money on those scheduled visits. But what it means is that the CDPH is the one that is determining that schedule. And yes, they're not going to say it's on a whim, but they're determining it on their science, not on, they're not following what the federal government is saying, or the Committee on Immunization Practices is saying. Okay, what do you know about the agreement that Trump signed with Pfizer? A lot seems secret about it. Yes, I don't know much about it other than what's been in the mainstream news. There hasn't been, I haven't seen him put a statement out or a press release out that says more than what it actually is. My understanding is that it will require Pfizer specifically, I think he's trying to do it with the other pharmaceutical companies as well, that they match I think it's, and don't quote me on this, but the lowest possible price for a drug, that is matched in the United States. So if you go to other countries, medications are a lot less expensive than they are in the United States. And so I believe who knows what else they talked about and what else is in the deal, because the deal is certainly, the contract or the deal is not in the public eye. But my understanding is that that's what it said, what it would do is allow us to have lower cost pharmaceuticals from Pfizer specifically, including vaccines. Okay, next question. I believe that government institutions which cover public safety are given police powers under the 10th Amendment, hence why maybe these institutions operate so aggressively. I think focusing on the liability exemption is not exhaustive of ways to attack these policies? What about freedom of competition? What are impeded when corrupt companies operate without any risk or liability? How is it fair to new entrants in the market space, which may have healthier and better products? Can such case remove the police powers and exemption from liability? Great point. And I don't, if you know me, I throw spaghetti at the wall. We try a million things and hope that something sticks. So I agree with you that I think the liability side of things is one aspect of it. I think there are other aspects to it. I think one thing that was really interesting to me, and I don't know whether he said it on purpose, like I don't know whether he actually got it or whether he would just made a I'm not going to say a mistake, but said something that wasn't 100% accurate or what he was thinking. But Trump, in his presentation or press conference on autism, that was this last week or the week before, specifically said that vaccines should be broken up. And I think, and he said MMRV. And I think he was referring to the ACIP guidelines, which said, that the MMR and the V should be separate. But there is also a call for having the measles vaccine, the mumps vaccine, the rubella vaccine, and the varicella vaccine, and having them separated out. And that's how they used to be. So when I was a child, you got the way it was actually interesting. In England, when I was growing up, you were allowed to get all the diseases when you were a child, and I had them all. When I went through my sister's medical records, she got the rubella vaccine like around 12 years old. And I said to my mom, I was like, why did she do that? Like, why didn't I get it? And she's like, oh, you had rubella. But rubella, for those of you who don't know, if you get it when you're pregnant, can cause congenital issues. So it can cause issues with your fetus. And so they, in England at that time, were giving the rubella vaccine to, if you hadn't had the rubella disease at puberty. And that to me kind of makes sense, right? So there's at least logic to it. But you could get the individual vaccines. So if you had one disease, you didn't have to get them all. Or, for example, we have a case where the child had the first one, had a reaction to it, had titers tested, so had antibodies tested, and they had antibodies for measles and for, I think it was rubella. They didn't have titers for the mumps portion of it. But in order to be fully, vaccinated, quote unquote, they had to have the whole MMR vaccine again. And if, that's what they would have had to, they chose not to, but that's what they would have had to have. And so it's interesting to me because it is another, and you take countries like Japan. So Japan moved their MMR vaccine, their measles, mumps, rubella vaccines to 2 years old, not 1 year old. And they also split them up. So, and I need to look this up because I keep talking about this and I don't remember which it is, but they have two. So either measles and rubella, they have one combination, which is two of them, and then they have a separate one for the other one. And they have much, and again, not causation, it's correlation, but they have much lower rates of autism and have seen much healthier children since they made the move to not vaccinate children until they're 2 years old. So I think that's a place also where, I think there is, when I'm going back to this question, it boggles my mind that there is not more than one MMR vaccine on the market. It boggles my mind that there is not another varicella vaccine on the market. There's enough competition, or there's competition for the Tdap, so tetanus, pertussis, and diphtheria. There are various numbers of that, although depending on what age group you are, they are age specific pretty much. There's some overlap, but there isn't a huge amount of competition there. And so I absolutely think that it would be beneficial to have competition in there, both from other vaccine manufacturers, but I don't think they want to get into it because I see them seeing that it's not a winning effort at this point. But I also think that there are other options, and that there are other healthcare options, and I say healthcare, not sick care options, that parents can and people can use, and medications that they can use, not prophylactically necessarily, but to treat these, that we're not dying from these. But I will say, one thing on that front, and this isn't to this question, but I have a lot of parents coming to me now that either have vaccinated their children and are choosing not to vaccinate their children anymore, or have had, a third child and have chosen not to vaccinate that child. And, they ask me, well, what can we do? What do you recommend? And my biggest recommendation is two things. One, know these diseases. So if your child were to get any of the diseases that you would vaccinate for, measles, mumps, rubella, pertussis, all of those, what would you do if your child got those? And how would you treat it? Who would you go to? What doctor would you go to? Would you go to the hospital? Would you go to, what vitamins, what supplements are you going to be giving your child? So know the diseases and the risks of the diseases. If your child were to get polio, really, really, really unlikely in the United States, but if your child were to get polio, what would you do about it? Like, are you okay with that? And weigh those benefits and the risks. But then the other piece of it is you cannot go into this with a whole bunch of toxicity in your life. So if you're eating ultra processed foods and you're, drinking as an adult, you're drinking and you're smoking and you're depleting your immune system completely and you're depleting your health completely, when you get a disease that you could have been vaccinated for, it's going to be a lot worse. And so, I mean, even something like the flu, vaccine efficacy is crap. It's completely awful. But, if you are not healthy to begin with, and you have chronic disease and you are, or even acute disease, like you are not going to be able to fight that disease as well as if you were a healthy person. So, and I think that's a place, I was having a conversation. I was interviewed by an Italian TV show last week on the vaccine issue. And, I would say, one of the things is to ensure that you are living the healthiest lifestyle that you can in order to, when you get disease, when you get sick, to fight it as best you can. And I think I think that's something that is really, really important to think of. And we've got such high levels of chronic illness here in the United States that, it's almost starting there than the vaccines. It's ensuring that we can get, we can keep healthy and have healthy children. But the other thing that I was telling them was that, I would say the people who are questioning vaccines are probably the most educated on all these fronts. I think the MAHA movement is a powerful movement of extremely educated people. Even if you're just MAHA on food and food dyes or glyphosate, GMOs, like these people are super educated on those issues. So those are all the questions I have gotten this evening. If anyone else has any more questions, let me know. But if not, I am going to wrap up here. So anyway, thank you so much for this evening and for your questions. And I hope you all have a great evening, and I will see you next time. Take care.